African American men are probably our most difficult patients as far as getting them into the doctor. Most of the time when I see an African American male brought into the doctor and they're in their 40s and their 50s and they say, I haven't been to the doctor, my first question is, so your wife made you come? And 9 times out of 10, it was either wife, girlfriend, or daughter, or someone that made them come. It wasn't a voluntary thing that they did on their own. And I think a lot has to do with the fact of that there's a fear. Some people fear that if I don't know, I'm okay. I don't want to know. And some people just feel that I feel okay, so I must be okay. And that there are a number of things that where you can feel okay and can still be a danger to your life. And African American males also have a very, very strong sense of themselves. And so they feel they can do it all and they don't need anybody's help. And so it's sometimes considered a weakness in the community if you ask for help. And so coming to the doctor is sometimes looked at as asking for help. And so sometimes they have to be encouraged to do it. At most programs that I do at churches and stuff, whether it be like on prostate health and things like that, most of my audience are women. And usually if I come back, they've brought their husbands then at that point, or they encourage their husbands to go to the doctor. So that's usually what causes a lot of African American males to come to the physician. And it's not usually, like I said, on a voluntary basis. So you try and impact and get them where you can, okay? That's why doing health fairs and going to the churches, things like that, is getting them where they're at and encouraging them to come and see you. And once they start feeling comfortable with you, they'll start coming to see you more often. Patients should build a trust with their physician. That's how they're able to understand and kind of deal with changes in medications. We as a society, an African American society, we have a very large distrust. There's been issues in the past where we have been experimented on. We have been used as guinea pigs. And that is still fresh in a lot of people's mind. It's not that far removed where we don't remember it and some of us don't know people that were affected by it. And so in order to build, you have to build a trust. And building a trust is, with some people, is having a physician that looks like them, having a physician that talks like them. And so in doing so, that develops trust. When you have physicians that are not, don't speak their language, that don't understand their culture, that don't understand their habits, they have a tendency to be more mistrustful of them. When you establish trust with your physician, and then you don't feel like when they change your medications that they're experimenting on you. Especially, it's also important for the physician to make the patient feel comfortable and to explain to them. A lot of times a simple explanation is all that it takes in order to get people to say, okay, I understand why we're doing this. I think patients that go to a clinic and don't have one physician that they see on a regular basis, that one way of helping to control their blood pressure is to be as knowledgeable as they can be about their medications. On every clinic visit, you realize you may see somebody different. So you bring all your medicines with you, okay? So that even though you may not know all the names of it, you can show it to them. And so they have an understanding of what you're taking. But it requires the patient to be more proactive as far as what they need from this visit or what they are coming in to be seen for. We do see a number of patients who have cost as an issue with their medications. There are a number of places now that are giving discounted medications. And so we try and steer them toward those. Initially it was major retail stores that had pharmacies, and now we're seeing it more and more in general on a lot of the pharmacies. There are also different organizations that will try and help patients as far as with their medications, and as well as some of the drug companies that when patients don't have insurance or they're unable to pay for it, they do have programs in which they're able to provide medication to them. The drawbacks with those is that, especially within our community, is that in order to get into these programs, they have to divulge financial information. And they don't like doing that. And so sometime in risk of their health, they would rather not do that. I think in the community, most people get their information from physicians. They also get it in church. We do a lot of church sponsored events, whether it be health fairs, blood pressure screening, cholesterol screenings, diabetic screenings, and we tend to get a large turnout at churches, especially if it's incorporated into some events that is going on at the church, whether it be a revival, whether it be a visiting minister or something, in which you're going to get a large amount of people that are going to show up. And I think a lot of people do get their information from those places. Unfortunately, they get a lot of misinformation from community and from asking friends and things of that sort. And so I think it's important to point them in the direction where they're going to get accurate information. And those are usually with your physician, usually hospitals, usually health fairs and things of that sort. The pharmacy is also a key to getting information. A lot more pharmacists are becoming more community oriented, and they are, encouraging patients to ask questions about their medications. They're becoming more knowledgeable about certain medications, what's appropriate, what's not. And so that can be a source as well for people who may not have a regular doctor that they visit, or be in a program or be in a community where they have access to such information.